then the insulin will still carry the sugar normally to go and take it into the cell. The cell will refuse, say that the insulin is not the insulin, but it is still the insulin that had been working before, but certainly the body will not recognize it again. So that is what we call insulin insensitivity. The tissue become insensitive to the insulin. What happens is that is type 2 diabetes. So in type 2 diabetes, the insulin is there, the sugar is there, and the insulin is willing to do its work, but the receptors refuse to acknowledge that insulin is there. That is insulin insensitivity. So the way you treat that one is to give a drug first that will make the tissue to recognize insulin. So because there is already enough insulin, in type 2 diabetes, we don't start treating them with insulin. We start treating them with drugs. I don't know if you understand. So you give what you call sensitizer, insulin sensitizer, or secretagogue. When you give these two drugs, it will actually bring down the blood sugar level. But in type 1 diabetes, remember that I said that in type 1 diabetes, there is no insulin in the system. So even if you give those drugs in type 1, it will not work. Because what the drug does is that it makes the tissue to now accept the insulin with the sugar. But when there is no insulin, there's nothing they will accept. So in type 1 diabetes, usually we give the people insulin. And again, in pregnant women, we might go to insulin in pregnancy. Number one is that if you have diabetes in pregnancy, it might behave like that of type 1, because most people that are pregnant are quite young. I don't know if you understand. So if you have diabetes in that case, some of them will give insulin. But there are basically, apart from that, there is pregnancy-induced diabetes. There are so many types of diabetes, but to a layman, we have type 1 and type 2. So in type 1, there is no insulin. It occurs in younger people. Treatment is insulin. In type 2, if you measure the insulin in the body of a person that have type 2 diabetes, initially, once you just diagnose that, if you measure their insulin level is even higher than the insulin level of normal people. So they have hyperinsulinemia, yet the blood sugar is high. So by the time you give them some drug, which is called insulin sensitizer, then the blood sugar comes down. I don't know if you understand. So our treatment in both differs. So in some people, we have type 1. In type 1, you must give insulin. Tablets will not work for them. In type 2, you don't give insulin. You have to give tablets. But there is another group that is called insulin requiring type 2 diabetes mellitus. That is type 2, but it requires insulin.